Bismillahirrahmanirrahim and Assalamualaikum. Hi, my name is Nur Fatia binti Muhammad Afandi. So today, our group will present about nutrition for food service. First of all, I will introduce my group members. The first one is me, Nur Fatia binti Muhammad Afandi. Next is Muhammad Azizul Ikhwan bin Zulkarnain. One Irfan Hafizi bin Wan Kamar Zaman. And the last one is Nazrul Daniel bin Jismi. For the introduction, the health-conscious target market is an intriguing and ever-changing demographic. The Food Industry Association keeps tabs on these consumer demographics and trends. According to a recent report, the definition of healthy among American consumers is changing. According to the Power of Health and Wellbeing in Food Retail 2020 report, this group values convenience, affordability, clear labeling, food safety, taste, and transparency in addition to health. Next.
So, hello, my name is Muhammad Zulikwan. So, I want to talk about what is diabetes. Diabetes type 1, your body does not produce insulin if you have type 1 diabetes. Your immune system attack and destroy insulin producing cell in your pancreas. Type 1 diabetes is most commonly diagnosed in children and young adults, but it can occur at any age to stay alive. People with type 1 diabetes must take insulin every day. So next type diabetes type 2. If you have a type 2 diabetes, your body does not make all as insulin well. You can develop type 2 diabetes at any age, even during childhood. However, this type of diabetes occurs most often in the middle age and older people. Type 2 is the most common type of diabetes. So next, gestational diabetes. Gestational diabetes develops in some women when they are pregnant. Most of the time, this type of diabetes goes away after the baby is born. However, if you had gestational diabetes, you have a greater chance of developing type 2 diabetes later in life. Sometimes diabetes because during pregnancy, initially type 2 diabetes. So the next is diabetes problem. Diabetes significantly raises the risk of the variety of cardiovascular problems, including the coronary artery disease with chest pain, angina, heart attack, stroke, and artery narrowing. Atherosclerosis diabetes increase your risk of development heart disease of stroke, the damage to the nerves, neuropathy. So the next is how diabetes occur. Diabetes is a disease that occurs when your blood glucose, also known as a blood sugar, is too high. Blood glucose is your primary source of the energy and is obtained from the food you consume. Insulin are hormone produced by the pancreas aids the transport of glucose from the food into the cell of as energy. So the next is causes of this diabetes. Diabetes mellitus refers to a group of diseases that affect how your body use blood sugar. Glucose. Glucose is vital to your health because it is an important source of energy for the cell that make up your muscle and tissue. Yet also your brain's main source of fuel. So the next sign of diabetes. Firstly, you urinate. Second, lose weight without trying. Third is feel very tired. The fourthly, dry skin. And the five, healing slowly and sleep very hungry. So the next is complication of diabetes.
So my name is Waifan Habizi. Diabetes health complications include heart disease, chronic kidney disease, nerve damage, and other oral vision, hearing, and mental health issues. Learn how to avoid or postpone this diabetes complication, as well as how to improve overall health. Treatment of diabetes. Diabetes self-care is an important aspect of diabetes management for diabetics. Diabetes patients are at risk for a variety of complications, including kidney failure, blindness, amputation, and heart disease. Heart disease is also the leading cause of death in diabetics. A diabetic patient has many daily responsibilities, including adhering to a diabetes treatment regimen, checking blood sugar at home, being physically active, eating healthy foods, and keeping healthcare appointments. Treatment to actuate attacks. For nearly a century, Bangor has been used as a diabetic treatment. In the 1920s, an Indiana doctor named Charles got diabetes, a wonderful treatment for diabetes that he claimed was the absolute cure. The formula, according to Gad, was disclosed to him by a European woman. The yellow-brown medicine, which was basically saltpeter potassium nitrate, dissolved in vinegar, was said to stimulate digestion. Next is long-term treatment diabetes. The good news is that you can lower your risk of long-term diabetes complications by keeping your blood pressure, blood glucose, and cholesterol levels within the recommended ranges. Being a healthy weight, eating healthily, limiting alcohol consumption, and not smoking will also help reduce your risk. If you have diabetes, you should eat a wide variety of nutritious and healthy foods and avoid snacking on sugary foods. Nutritional for diabetes. Carbohydrates are the primary source of nutrients required by the body to generate energy. It functions as a fuel, providing us with the OM OHM to keep us going. Carbohydrates are classified into three types: simple carbohydrate or sugar, complex carbohydrate requirements differ from person to person depending on age, gender, and health status. Prevention of diabetes. Regular health screening, healthy diet, exercise, no smoking, and drinking. Oh, sorry. Okay, next I pass to the Nazrul Jalil.
Hello, now I will explain about prevention diabetes. Number one, regular healthy screening. Know your risk by trying out online risk screening questionnaire and go for a test if you are at the risk. Healthy diet. Add in moderation, increase of your intake whole grain, fruit, vegetable and reduce intake sugar. Exercise. Adopt a active lifestyle. Try 150 minutes of exercise every week. Find an activity like swimming, jogging, tai chi or yoga. Number 4, no smoking or drinking. Try to quit Try to quit smoking and limit your alcohol intake. Next, can diabetes inherited? Type 2 diabetes can be inherited and is linked to your family history and genetic, but environmental factors also play a role. Not everyone with a family history of type 2 diabetes will get it, but more, more likely to develop it if a parent or sibling has it. Next, stage of diabetes. Number 1, stage 1 insulin resistant, sometimes called impaired insulin sensitive. Second, muscle fat and liver start to struggle to respond to insulin. 3, the pancreas work harder to compensate by making more insulin. 4, blood glucose level remain normal. Stage 2, pre-diabetes, sometimes called impaired glucose tolerance. 2, pre-diabetes is when blood glucose level become high, then usually yet not considered high enough for type 2 diabetes diagnosis. Stage 3, type of diabetes, blood glucose level have continued to rise and are now considered within type 2 diabetes range. Diagnosis criteria for type 2 diabetes: fasting plasma glucose, oral glucose tolerance test. Stage 4, type 2 diabetes with complication. Type 2 diabetes continue to progress and complications occur. For the example, SRD, neuropathy, retinopathy, increased risk for a stroke or cardiac event. Next, I will pass to Novatia to continue consultation.
Okay, last but not least, for the conclusion, to summarize, diabetes is extremely dangerous regardless of age. As a result, we must watch what we eat and drink in order to avoid diabetes. If it is inherited, we can prevent it in a variety of ways. As a result, hopefully the above can be of assistance and cause concern. Thank you, and that's all from us.